welcome back. If you're just joining us, we are speaking with Congresswoman Nan Hayworth, Republican representing the Hudson Valley, currently New York's 19th district, running for re-election in the redistricted 18th district. Gets a little bit confusing, but it's the lower Hudson Valley. We talked briefly in our last segment about health care reform. We know very well that you are in favor of repeal and replace. Wanted to run through just a couple of the benefits that Obamacare or health care has included in it. Kids insured through 26, preventative care, no lifetime caps on what you can get, no pre-existing condition bans. Insurers have to spend 80% on care. You see the rest of this list here. What on this list is objectionable to you? What on this list don't you like?
Well, nothing's objectionable in principle at all. You know, I want every American to have access to good health care at costs that they can afford, and to have affordable, portable health insurance. So I fully endorse the goals of the 2010 health law. I always have. But it's the wrong law. It's not the best way for us to get there. It's a very costly way for us to get there. It will take away from the kind of choice and the kind of quality, the kind of innovation, all the best things that we want every American to be able to enjoy as part of what, American medical care at its best. I can say that as a physician, as an eye surgeon who practiced for 16 years in Mount Kisco. It's the best care in the world. We want everybody to be able to have the best care in the world.
But it's not the best care in the world for the 30 million Americans who don't have insurance and can only rely on emergency room service.
Let's make it easier for them to get insurance.
This plan was set up as a way to keep the insurance companies in business and to not put too much of an imposition on too many participants in this, doctors, hospitals, that sort of thing.
But it will put a $2 trillion cost to administer this massive program, at least $2 trillion, Andrew, on the economy over the next 10 years. CBO, I think, has said it's at least $1.76 trillion, and we already have nearly $16 trillion worth of debt. That's more than $50,000 per man, woman, and child in this country. To add another $2 trillion of cost from Washington, and to have the federal government essentially controlling and administering our health care is something that is not going to benefit us. It's actually going to hurt us. We can do far better.
It would benefit the 30 million people who don't have insurance.
We want to benefit those 30 million people. I couldn't agree more, but there are better ways to do it. What we should have is a mechanism like what they've done in the state of Indiana with Healthy Indiana. Health savings accounts for everyone, real tort reform, real liability reform. That's a problem unique to the United States. It adds enormously to the cost of care in this country. And we need to make insurance products accessible across state lines, which right now they're not.
Your party in Congress and you as well have voted, I forget, 32, 33 times already to repeal the healthcare reform law.
Twice for full repeal, and to be followed immediately by replacement. Twice to do that. Yes, there have been, with Democratic support in these various votes, there have been 31 other votes in various forms to defund certain aspects that are most wasteful in this massive program. There are a lot of so-called discretionary funds or slush funds that were allowed to be administered by the Secretary of Health and Human Services, and those are not accountable. That's not smart.
Your votes to replace, that you said followed the votes to repeal, how are you paying for those benefits that we showed earlier that the healthcare reform system provides?
Well, the idea is to allow an affordable system that we can have based in among our citizens, and have the control between patients and their doctors and their providers. We all pay for our health care, whether we pay it through our taxes to our federal and state governments, or whether we pay through our own direct contributions to buying various types of insurance that we purchase ourselves, or through what our employers purchase. And then, of course, that's as customers and clients of various companies, we help pay for health care that way. Health care is always paid for by us. So I want to make sure that people get every dollar's worth of value from their health insurance that they can. Administering it through a massive Washington bureaucracy takes value away and takes dollars away from care.
But without paying for it, those benefits don't happen.
We are always going to pay for our benefits, Richard. I want to make them as least costly as possible, because we pay for them through the 2010 health law. We pay for them dearly through our taxes and through fees. and through taxes on medical devices that are already driving medical device manufacturers out of the United States. It's a very costly way to do it. I want to make sure that we get the best care for the least cost to us and honor all of those good goals. They're all good things that, yes, we can absolutely do, but we can do it much smarter. Health savings accounts for everyone, buy insurance products across state lines, real tort reform, problem unique to the United States, and then we can very easily provide for anybody who would find it difficult to get insurance because of pre-existing conditions. We can do this.
Congresswoman Nan Hayworth, you're taking the smart approach. You're skipping the convention next week and not tiptoeing around Hurricane Isaac. I unfortunately will be.
I wish you luck.
Thank you so much, and thank you for coming in and for speaking with us today. Really enjoyed it.
It's always a pleasure.
All right, and we're going to come back after a quick break here on RFL. When we do, I'll be joined by our panel to sound off on the latest presidential